Right now, we have a crisis in my country where there's so many teen pregnancies. And when you go back, you realize that there is the aspect of lack of information, lack of education, and there is the aspect of access to health is very limited to these girls. So the aspect of gender equity is very important because there is a particular gender, there is a particular minority that is carrying the weight of new HIV infections.
So, Doreen, amazing to meet you. I feel like we know each other. I've seen so much of you on the various kind of posters, and to meet you in person is delightful.
First of all, I'm so glad to be here. And glad to meet you as well. It's what we started in 2020 with the HIV in ViiV project. And when we started that, it was, how would you love to change the face of HIV through pictures? And that is something I do every day. I love taking pictures. The face of HIV over the 40 plus years has always been a thin, emaciated person who is unhealthy. So how would you want to change that picture to the person who is currently living with HIV, who is taking the treatment well, and who is just living life beyond their diagnosis? And I was like, yeah, that is definitely something that I can do. And we took pictures, my favorite picture being the one that I'm hugging my friend, that is everywhere now. And that picture actually alone on itself stands out for me because part of the stigma that I faced was from my own family members. I had like my own utensils, they were disinfected, they were sun-dried because of the misinformation around stigma. And when every time I see that picture, I see love, they seeing the human. And that is now how we started. So when we came with 4 of the other visionaries to create content around HIV, to use our content so that it can counter the stigma related to HIV, and to, at the end of the day, give hope to people living with HIV that they're not alone.
And you touched on an incredibly important point there, which is stigma. I mean, we have come so far from a scientific perspective. Antiretrovirals are now globally available. Someone living with HIV lives exactly the same amount of time as someone that is not living with HIV. But stigma remains, and that's why the HIV in ViiV program was just so important, because it gives the opportunity to show incredible, vibrant, amazing people like yourself living healthily, happily, and thriving. And I think when I saw you earlier on, I said, oh, I feel like I'm meeting somebody famous.
Yeah.
And the reason I said that was because actually that picture of you hugging your friend had such emotion and such positive vibes just radiating out from it. And that's why we have it right in the middle of our office, because every day we look and we say, this is what it's like living with HIV, and not the misperceptions that people who don't get to connect with the community may have. So you're sending that powerful message out to everybody every day.
Yeah.
Can I just ask you a little bit about female empowerment, something you're very strong in terms of how you articulate who you are and what it's like to be an independent, strong, vibrant woman living in Africa with HIV. Talk a little bit about what you've done to really support women who are living with HIV and be a role model for them.
Right now, we have a crisis in my country where there's so many teen pregnancies. And when you go back, you realize that there is the aspect of lack of information, lack of education, and there is the aspect of access to health is very limited to these girls. So a 15-year-old girl cannot walk to a facility and get a family planning method. They can't walk to a facility and be given even a condom, just a condom, nothing else, because their age is limiting them. But again, this is a young woman, this is an adolescent girl who is at risk. Why are we not humanizing the aspect that at least she has come to the hospital, she needs this service, she needs even the information, just the information on how to stay HIV-free, prevent an unplanned pregnancy. But we don't want to look at it from the human aspect. We are just looking at it from the health aspect of this is the moral part, and we are we're just closing the chapter on them. So the aspect of gender equity is very important, because there is a particular gender, there is a particular minority that is carrying the weight of new HIV infections, and now that is creating a whole ripple effect of health inequities or health inequalities. It's a fight that we fight every day. So I want to educate them. I want to show them that yes, you are HIV positive, but your life does not end there. You are a strong Black woman who can live your life beyond your diagnosis.
If you ask me what my dream in my job is, right?
Yeah.
There are 30 million young women and adolescent girls in sub-Saharan Africa who could benefit from PrEP, a discreet PrEP which gives them power to live the life they deserve to live. So my dream is that every one of those adolescent girls and young women get the chance to have access to that medicine.
You know, my dream is to see a world where children are not born with HIV. And I feel like with giving adolescent girls and young women the power to prevent their HIV status, then we can achieve my dream, and we can achieve your dream.
Exactly. Exactly.
Yeah.
This is a conversation where both of our dreams are very well connected, and I think actually can be achieved. I believe that actually in our lifetime, we'll be able to achieve that, which is an incredible thing to think about. And you're playing an important role in that. Thank you so much. Oh, I've met a famous person today. This is like, yay! Whenever I walk past that wall now, I'm going to think of you always. Yeah, thank you.
Thank you so much, Deborah.
That was brilliant. Thank you.